Hey there, my name is Megan Clanahan. I am the co-owner of Houston Moms. And for the past few months, we have been coming to you in partnership with UTMB Health to bring you providers who can share important health information for you and your family. This month's focus is on urology. So I do have a small disclaimer. If you have maybe little ears in the background, you may want to save this video and come back to it because we will be talking about, genitalia and parts and anatomy as it relates to urology. And so if those aren't words that maybe you want your little ears to hear, definitely save and come back. So we are thrilled to have two fantastic providers from UTMB Health joining us today. I have Dr. Milburn over here. Well, I never know, it's over here, and Dr. Alzweri below me. And both of them are with UTMB Health. I'm going to let them each introduce themselves and with their specific background and where they practice. Dr. Milburn, we'll start with you.
Hello, thanks for having me, Megan. My name is Nickie Milburn. I am currently working with the Department of OB-GYN at UTMB, and our subspecialty is called Urogynecology. I've been with the practice since 2017. I've been practicing as a nurse practitioner since 2015. I started my nursing career as a labor and delivery nurse and have over 18 years of experience with nursing in women's health.
Fantastic. I know that you will be a great resource for all our moms out there for this specific topic. Thank you for joining us. Dr. Alzweri, to you.
Hey, hello everyone. Thank you for this kind introduction and for my colleagues on the call. My name is Laith Alzweri. I'm a urologist and I'm also the director for men's health and male genitourinary reconstruction at UTMB. I've been a urologist for almost 10 years now, and very proud of our men's health program here at UTMB and for your invitation to talk about men's health at the Men's Health Month. Thank you.
Yeah, we are so glad to have you. And we actually had an opportunity to speak last week. And I know I heard your passion about this. And so obviously, most of our audience is Houston moms, but most of us have partners or men in our life who we care about. And so let's start with the basics. What is a urologist? What is your role?
So urology is a specialty that looks after the urinary tract in men and women. When we say urinary tract, we mean the kidneys, the ureters, and the bladder, and then the urethra. So basically, everything related to production of urine. So urologist looks after men and women in relation to their urinary tract, which is kidneys, ureters, bladder, and urethra. In addition, we also look after men reproductive health in terms of infertility and also sexual dysfunction. So I specialize in men's health and male reconstruction. So that's one part of urology.
Okay. And so full disclosure, both my husband and I have seen urologists for varying reasons. And I know it can feel, it's a special area. It can feel a little bit intimidating. And, in your experience, who needs to see a urologist? What are the reasons that people are coming to you to see a urologist?
That's a great question. I think living in 2021 with all the plethora of information that we have around us, it's a great point that you've raised. I tell people that if you have a headache, you see a doctor. If your arm hurts, you go and see a doctor. If you have any problem below the waistline, you go see a doctor. It's just a problem like any other problem. We really should move away from any kind of stigma. Yes, it can be intimidating, it can be embarrassing, but when we are working with patients to improve quality of life, you go and see a professional who qualified to help you, and that will improve quality of life. So I'm glad we're having this to raise awareness about that. And I'm sure my colleague, Dr. Milburn shares the thought with me. So going back to your question is, what kind of common things we see patient about as a urologist? First, we start with women. We see them in addition to our, primary care physicians or, OBGYN, we see them for recurrent urinary tract infections. That's a common problem. Kidney stones. Kidney stones affects about 1 in 10 Americans, and in the next 20 years, it'll double, thanks to our great diet and healthy lifestyle. Unfortunately, and we also see increasing trends of kidney stones in kids as well.
Okay.
In terms of men, we see them for prostate problems. As you know, the prostate continues to grow, causing problems in passing urine. Elevated PSA, and related to prostate cancer. Male-specific cancers like testicular cancer is also something that we see, in addition to kidney cancer and bladder cancer for men and women. And finally, we also tackle problems related to quality of life. So if women have pelvic organ prolapse, we share care with our, OBGYN colleagues, if men have urinary incontinence because of advancing age or after radical prostatectomy, we take care of that. If people have erectile dysfunction, low testosterone, so all of these are things that we look after. I tell our men, if you service your car once or twice a year, you need to service your body as same or more. So if you have a primary care physician, if you're a man, you should have a urologist. If you're a woman, you should have a gynecologist.
Okay, so I haven't heard it put that way before, because I think women automatically assume, or at least, when I reached 18, I'm like, okay, I need my GP and a gynecologist, but I don't think that men often think that they need to have something in their, that person in their arsenal. But I think that's such a solid point. They need to take care of themselves. And, I think it's interesting as a wife to, how do we tell our men to go and, get things checked? But hopefully some will see this and we'll make that relation like, hey, if we're doing it once a year, you can too, right? I'm going to flip over to Dr. Milburn, and I'm going to come back to you though, because I have a question about when men should be screened for prostate cancer. But so flipping back over to Dr. Milburn, tell us a little bit about what your specific practice is. This urogynecology, it's a term I'm not wholly familiar with, and I think maybe our audience needs a little bit of introduction to what exactly that means.
So the urogynecologists are actually, they're OB-GYN doctors who have gone back and gotten some extra training, additional training to take care of women who are having problems with their female pelvic organs, the muscles, the tissues, things like leaking urine, involuntary loss of urine is called incontinence. So any dropping of the pelvic floor organs, such as your bladder, your vagina walls, your rectum, or your uterus, that's called a prolapse. So we care for those patients. And we also manage patients, like Dr. Alzweri said, with recurring urinary tract infections with our urology partners, as well as overactive bladder patients. And that means overactive bladder, just for the sake of description, means if you're going to the bathroom more than 8 times a day, waking up all times of night to go to the bathroom, and you can't quite make it to the bathroom and you're leaking urine, that's considered overactive bladder. So we treat patients with that as well.
So I think that's such an important part, because we often hear about overactive bladder like on commercials or whatever, and we don't know exactly what the definition of that is. I will say I'm a mom of twins. They actually turn 11 tomorrow, but they left behind some parting gifts, right? When I was carrying them. And I'm sure many moms can relate that, jump roping at the gym and all of those things. When do we know that leakage and, pain and all of that warrants going to see someone like yourself?
So what I tell my patients is urinary leakage or involuntary loss of urine is very common, but it's not normal. So anytime you have involuntary loss of urine, you should come to the doctor. You should come and get evaluated to see. There are two types of incontinence that we manage. So there's not one thing that can fix everything. So we do have to discuss and discover and assess and figure out which type of incontinence you may have. But anytime you have involuntary loss of urine, you should come to the doctor.
Okay. Things I did not know. I mean, I've just kind of accepted as fact that maybe I shouldn't jump on a trampoline. But, I think that's a really good point. And so with your specific, how do you differ from a urologist?
So what I tell my patients to kind of keep it plain and simple is we help patients with more of a structural problem with their bladders, and the urology, our partners in urology are more of a functional. So if you have things going wrong with how your bladder really functions, we're going to send you to urology to figure that out. But if it's a falling down or just a cosmetic type of look of how your bladder is hanging out of your vagina, then most likely you're going to seek out a urogynecologist for that.
Okay, that's a great point. So let's talk about that. I mean, because that's a very sensitive thing for a woman to admit, for a mom to admit. We're also, a little bit of mom martyrdom. We're taking care of everyone else before ourselves. What would be your encouragement to Houston moms if they're experiencing those types of things that we just talked about?
Right. So sometimes there's a little gray area of whether I should seek evaluation for what I think doesn't look like it used to look before. So if you're going to go to your annual gynecology visits, bring up the conversation with your gynecologist, because they will be able to guide you to say, okay, this is something that we should get your Urogyn involved with, because this is something that they can help you with. Or they can probably initiate the treatment. So something like overactive bladder or pelvic floor weakening, they can send you to pelvic floor physical therapy, or they can start a medication. So just have the conversation with that gynecologist if you're unsure, and let's say, hey, I don't think things look like they used to look before I had children. Is this something wrong? And they'll be able to guide you where you should go.
Great. I love that. And I also I've gone through the pelvic floor therapy as well. And it's not the most fun I've ever had, but it did help and it did work. And it did start with having that conversation with my gynecologist. Now, with your particular field, I assume it requires a special referral. Is it typically covered by insurance? How does that look like?
Yes, so our services are covered by insurance most of the time. You have your traditional specialty copay, whatever that may be with your specific policy. Some patients' insurances require referral for any specialty care, and then sometimes you can self-refer. So it's just going to depend on your coverage.
Okay, so talk to your gynecologist or talk to your GP, find out what you need to do. Such great advice there. Dr. Alzweri, I'm going to come back to you. So going back to the prostate screening, and for the men that are in our lives, whether they're our husbands, our partners, our dads, when is it recommended that men get screened, prostate screening?
Yeah, that's a great question. So, we generally suggest that any man who, at the age of 40, to have a relation with a urologist, to have a baseline checkup. And then in summary, we say the best option is shared decision-making. There are many situations where, prostate cancer screening is very important, specifically in men who have history of prostate cancer in their, uncles and father, siblings or cousins. So first degree relative, generally speaking, so we say in these situations, prostate cancer screening is important. For other men, for example, like African-American men usually have twice the chance of having prostate cancer compared to Caucasian men. So, so they have to have, prostate cancer screening earlier. The way we do it is that, generally speaking, men between the age of 40 to 70, once they have an encounter with a urologist or their primary care physician, they can have that discussion.
Okay. I did not know that about African-American men, that they had twice as high of a risk factor there. So that's something new I learned today. So you said age 40. Okay. So my husband's 41. How would you, I mean, being a provider who sees, men who may be like feeling uncomfortable about going, what would be your recommendation to either them or to the women in their life who are trying to get them in for screening, to make them feel better about it? Or what would you tell somebody who's sitting in front of you?
Exactly. That's a great question. So when we talk about men's health, we talk about, we talk about sons, we talk about partners, loved ones, husbands, brothers, friends, grandparents. So every important man for his family is what we're talking about. It's not merely sexual function or well-being. It's just, we want them to be as happy as possible in the best health they can be for themselves and for their families. So going step back, when we talk about teen kids, we should teach all of them about safe sexual practices. 1, 2 is we teach them about testicular cancer. It is a rare, treatable cancer, but if caught early, will be better. So we teach young men starting the age of 14, 16 to do regular testicular exam. So check yourself once a week or so. If you feel a lump in the testicle, most importantly, that doesn't hurt, it's painless, it's actually more worrying. I hate it when I see in the office a young man who has a mass in his testicle for a year. So he should have come way, way earlier. So that's for younger men. So moving forward, 20s and 30s, make sure that you drink plenty of fluids, have good diets, so you avoid the risk of kidney stones and all the good things in life. We have to remember, having good health is like wealth. It's a series of painful decisions, but with very rewarding results. So the more that you keep the weight off, exercising, avoiding smoking, drinking alcohol, excessive, of course, and having a reasonable lifestyle that will give them great credit into their, after the age of 40. After the age of 40, we have many issues. One is enlarging prostate, having problem passing urine. The prostate continues to grow, giving urinary problems into their 70s and 80s. So at some point, a man who has a prostate will require some kind of intervention. Secondly is low testosterone. About 25% of adult men in the US have low testosterone. That makes them grumpy. They lose muscle mass. They feel weak. They have low desire and they're less functional. Thirdly, erectile dysfunction. It affects about 52% of men in some sort of severity from the age of 40 to 70. So we're talking about widespread problems compounded by diabetes, hypertension, obesity, all the things that we talked about can add into that. But the good news is that there's a solution for that. There are caring partners who work, with their husbands, with their loved ones, encourage them to go and see doctors. And we have friendly providers at UTMB who are willing to work with you or any other provider. Once you establish the relationship, then we can start with it.
Such great things. Okay. 52%, that just blew my mind right there. I just need you to know that. And I think that's the crux of it, right? And I'm sure Dr. Milburn would attest that, taking care of ourselves, of our loved ones. I mean, it's an act of love. And I think it's an act of love for our children too, because ultimately we all desire to be here. And I won't tell y'all how many Diet Cokes I drink a day, but that's probably why I had kidney stones, right? So don't be like me, Houston moms. Y'all need to drink your water. Dr. Milburn, any closing thoughts before we wrap up?
Yes, I just also wanted to point out that, there's also this lack of understanding about involuntary loss of stool. Some women are very self-conscious about reporting that to their general practitioners or their OB-GYNs, but they also should know that there's help out there available for that as well. And they can see a urogynecologist for management with that too, or they can see colorectal or GI, but someone should, assess the situation and, refer them accordingly because they can get some help for that.
Y'all cover such an array of things with urogynecology, and I love that. If I think that's where you need the friendly face, the friendly provider, someone that you trust, and that y'all can help balance each other between urology, gynecology, urogynecology, your GP, all the things. Such a valuable information here. I know Dr. Milburn had to scrub out from a surgery. Dr. Alzweri, I know you're seeing patients all day. Your time is valuable and precious. And I'm thankful that you could spend it with us today, sharing some great information. As always, I will drop in the comments below the link specifically to urology and urogynecology for UTMB Health. We are so grateful they have partnered with us this year so that we can provide you information. If you have questions, you can drop them in the comments below as well. And the UTMB Health team will come back and make sure that you get answers. Or even, you know what, it's a sensitive subject. Feel free to DM. I'm the one who checks the DMs, and if you have a question and you want to ask, I will be sure and get it to the providers in a confidential manner. So feel free to do that as well. Dr. Milburn, Dr. Alzweri, thank you so much for joining us today. It was great to see you. Until next time, I'm Megan Cleanahan. We'll see you.
Bye-bye.